What if I told you that thousands of seniors in California are about to lose their Medicare benefits? Not because they did anything wrong, but because they didn't do one simple thing by April. Every year, millions of Medicare notices go unread, and studies show that a large percentage of seniors miss critical deadlines simply because they assume their coverage is automatic. The shocking part? Medicare doesn't always warn you loudly before benefits are paused or penalties begin. Here's what makes this even more alarming. Many seniors believe that once they turn 65 and enroll, Medicare is locked in for life. But hidden inside routine letters and policy updates is a requirement that, if ignored, can quietly disrupt your healthcare, prescriptions, and even monthly assistance. No sirens, no phone calls, just a sudden realization when coverage doesn't work anymore. So what is this one action seniors must take before April, and why are so few people talking about it? Stay with me, because by the end of this video, you'll know exactly what to do to protect your Medicare, your health, and your peace of mind before it's too late.
Number 1. Medicare is not automatic forever. Most seniors believe that once they turn 65 and enroll in Medicare, their coverage is permanent and untouchable. That assumption feels logical, but it's also where the biggest risk begins. Medicare is not a set-it-and-forget-it program. Behind the scenes, it operates on ongoing eligibility rules, confirmations, and annual checks. If certain requirements aren't met or verified on time, coverage can be paused, changed, or penalized, even if you've been enrolled for years. Here's the uncomfortable truth. Medicare expects seniors to stay actively compliant, not passively enrolled. Each year, systems managed by the Centers for Medicare and Medicaid Services review enrollment status, plan details, income-based assistance, and personal information. If something doesn't match, or if a required action is missed, the system doesn't wait for a conversation. It simply moves forward. That's why many seniors are shocked when a doctor visit, prescription refill, or benefit suddenly doesn't work. What makes this even more dangerous is that Medicare often communicates these requirements through letters, notices, or online updates that look routine and easy to ignore. A single unopened envelope or skipped message can create long-term consequences, including higher costs or delayed care. This is exactly why April matters. It's not just another month, it's a checkpoint. Understanding that Medicare is active, conditional, and time-sensitive is the first step to protecting your health care. Once you realize this, you're already ahead of millions who don't find out until it's too late. If this opened your eyes, don't stay silent. Drop a comment and tell us what surprised you most or what Medicare question has been confusing you for years. We put real research and serious effort into breaking these topics down, so support the channel by subscribing. It's just one click, and it helps us keep protecting seniors like you.
Number 2. Missing one notice can trigger a silent review. One of the most dangerous myths seniors believe is that Medicare will clearly warn you before anything changes. In reality, Medicare often works quietly. A single missed notice, whether it arrives by mail or online, can trigger an automatic eligibility review without any follow-up phone call. These reviews don't feel urgent when the letter arrives, but they can become very real when coverage suddenly changes weeks later. Here's how it usually happens. Medicare and related programs regularly check income details, residency status, plan enrollment, and assistance eligibility. If something looks incomplete or outdated, the system flags your account for review. The problem is that these requests are often hidden inside paperwork that looks routine or confusing. Seniors may assume it's informational, set it aside, or plan to read it later, only to miss the deadline entirely. Once the review starts, the process is automatic, not personal. What makes this even more frustrating is that Medicare systems don't pause to ask why a notice was missed. The review continues, benefits can be reduced,
delayed, or temporarily stopped, and fixing the issue afterward takes time and energy. That's why April is critical. It's a common cutoff period when multiple reviews overlap, especially for plan confirmations and assistance programs. Treat every Medicare notice as time-sensitive, even if it doesn't look urgent. One small piece of paper can decide whether your health care stays smooth or becomes a stressful fight to restore what you already earned. Quick question. Have you ever ignored a Medicare letter thinking it was nothing important? Tell us in the comments. Your experience could help another senior avoid a costly mistake. We put hours of research and care into these videos, so please subscribe to the channel. Just one click helps us keep sharing information that truly protects you.
Number 3. California adds extra rules most seniors don't expect. Living in California comes with benefits, but when it comes to Medicare, it also comes with extra layers of rules that many seniors never hear about. While Medicare is a federal program, California works alongside it with state-level systems, databases, and assistance programs. That means seniors here aren't just dealing with one set of requirements, they're dealing with two systems talking to each other, and when information doesn't line up perfectly, problems begin. Here's where things quietly go wrong. Changes that feel harmless, like moving to a smaller home, staying with family for a few months, changing mailing addresses, or switching phone numbers, can create mismatches between federal Medicare records and California's state systems. When those records don't match, it can trigger verification requests or temporary holds. Seniors often don't connect these everyday life changes to Medicare at all, which is why the consequences feel sudden and unfair. California is also known for offering additional support programs tied to Medicare, especially for prescriptions and out-of-pocket costs. But these programs require regular confirmation that your information is current. April is a common checkpoint when California reviews and syncs data. If a senior misses that window, assistance can disappear automatically, even though they still qualify. The key takeaway is simple but powerful. In California, Medicare depends heavily on accurate, up-to-date information. Staying protected isn't about doing something complicated, it's about understanding that even small changes matter more here than in many other states. California seniors, did you know your address or phone change could affect Medicare? Share in the comments if you've ever moved or updated your info recently. We put serious time and research into uncovering details like this, so please subscribe to the channel. One click helps us keep protecting and informing you.
Number 4. Missed paperwork can pause benefits without warning. Many seniors assume that if something is truly important, Medicare will call, email, or send multiple alerts. Unfortunately, that's not how the system works. Medicare relies heavily on paperwork deadlines, and missing even one required form can quietly pause your benefits, often without a clear explanation at first. There's no dramatic notice, no countdown timer, just a sudden problem when you try to use your coverage. This usually starts with a simple request: confirm eligibility, update income details, verify plan enrollment, or respond to a review notice. The form might look technical, confusing, or routine, so it gets set aside. But Medicare systems treat silence as a response. If the deadline passes, your account can be marked as non-compliant, triggering temporary suspensions or delays in coverage. Seniors often find out only when a doctor visit is denied or a prescription rings up at full price. What makes this especially stressful is that fixing the issue is rarely instant. Once benefits are paused, restoring them can take weeks of calls, resubmissions, and waiting, all while medical needs don't stop. April is a high-risk month because many annual confirmations and reviews stack up around this time. That's why paperwork isn't just paperwork when it comes to Medicare. It's a gateway to your health care. Treat every form as urgent, keep copies, and respond early. One overlooked document can turn peace of mind into a paperwork nightmare. Be honest, have you ever put Medicare paperwork aside thinking you'd handle it later? Drop a comment and let others learn from your experience. We spend hours researching and simplifying this information, so please subscribe to the channel. Just one click helps us keep seniors informed and protected.
Number 5. Medicare Advantage plans require extra annual confirmation. If you're enrolled in a Medicare Advantage plan, this part is especially important. Unlike original Medicare, Advantage plans operate through private insurance companies, and that means extra rules, extra reviews, and extra confirmations every single year. Many seniors don't realize that these plans are not passive. They require you to stay actively engaged, even if nothing in your life has changed. Here's where the risk shows up. Each year, Medicare Advantage plans must confirm that you're still eligible, still living in the service area, and still agreeing to the plan's updated terms. These confirmations often arrive as annual notices, plan updates, or verification requests. Seniors may assume these are just informational brochures and never respond, but failing to act can result in automatic disenrollment, sometimes without a clear explanation until coverage stops working. April is a critical period because it often follows major plan updates that take effect earlier in the year. If the insurer doesn't receive required confirmation, or if your information doesn't match what they have on file, the plan can quietly flag your account. Suddenly, doctor networks change, prescriptions aren't covered, or appointments are denied. Seniors often blame the clinic or pharmacy, not realizing the issue started with a missed Advantage plan requirement weeks earlier. What makes this frustrating is that many Advantage plans market themselves as simple and all-in-one, which creates a false sense of security. In reality, they demand more attention, not less. If you're in a Medicare Advantage plan, reviewing notices, confirming details, and responding on time isn't optional, it's essential. Staying covered means staying alert, especially as April deadlines approach. If you're on a Medicare Advantage plan, tell us in the comments, did you know it needs yearly confirmation? Your answer could save someone else from losing coverage. We put deep research and real effort into these videos, so please subscribe. Just one click helps us keep this information free and accessible.
Number 6. Low-income assistance can disappear automatically. Many seniors rely on extra Medicare assistance programs to help pay for premiums, deductibles, and prescription costs. But here's the hidden danger. These benefits are not permanent, even if your income hasn't changed. Every year, these programs require re-verification, and if you miss it, the help can vanish automatically without a clear warning. This is where seniors get caught off guard. Assistance programs linked to Medicare regularly check income records, household status, and eligibility documents. If a confirmation request goes unanswered, or if information doesn't match exactly, the system assumes you no longer qualify. There's no phone call asking for clarification. Instead, support quietly stops. Suddenly, monthly premiums rise, co-pays increase, and prescriptions cost far more than expected. What makes this especially painful is that many seniors still qualify but lose benefits simply due to missed paperwork or deadlines. April is a common review period for these programs, which means failing to act before then can trigger a chain reaction of higher costs that strain fixed incomes. Even worse, reinstating assistance is often slow. Seniors may face weeks or months of paying out of pocket before help is restored, if it's restored at all. The most important thing to understand is this: doing nothing is treated as a decision. Silence is interpreted as ineligibility. That's why staying alert, opening every notice, and responding on time is critical. These programs exist to protect seniors, but they only work if you stay engaged. One overlooked letter can undo years of financial relief, and April is when that risk is at its highest. This part matters. Have you ever received help with premiums or prescriptions and didn't know it could stop automatically? Share your experience in the comments so others don't get caught off guard. We put serious effort and research into breaking this down, so please subscribe. Just one click helps us keep seniors informed and protected.
Number 7. Prescription drug coverage is often the first to break. For many seniors, prescription drug coverage is the most critical and the most fragile part of Medicare. What most people don't realize is that drug coverage is often the first benefit affected when something goes wrong behind the scenes. Even if your doctor visits seem fine, your prescriptions can suddenly stop being covered without advanced drama or explanation. Here's why this happens. Medicare drug plans rely on active enrollment status, plan confirmation, and eligibility alignment. If there's a missed notice, an unresolved review, or lapse in verification, prescription coverage is frequently paused first because it's processed separately from medical services. Seniors usually discover the problem at the pharmacy counter when a familiar medication suddenly costs hundreds of dollars out of pocket. This moment is more than inconvenient, it can be dangerous. Many seniors depend on daily medications for heart health, blood pressure, diabetes, or chronic pain. Skipping doses or delaying refills because of unexpected costs can lead to serious health risks. And once again, April is a high-risk period. This is when many plan updates, confirmations, and assistance checks overlap, increasing the chances of disruption if something was missed earlier in the year. What makes this especially frustrating is that seniors often assume the pharmacy made a mistake. In reality, the issue usually traces back to a paperwork deadline or unnoticed notice weeks earlier. Prescription coverage doesn't disappear loudly, it fades quietly until it hurts. That's why staying alert to Medicare messages and acting before April isn't just about saving money, it's about protecting your health, your routine, and your independence when you need it most. Quick check. Have you ever gone to the pharmacy and been shocked by the price of a normally covered medicine? Tell us in the comments so others can learn from it. We put real care and deep research into these videos, so please subscribe. Just one click helps us keep sharing information that protects your health.
Number 8. Medicare notices are easy to miss and hard to undo. One of the biggest dangers for seniors isn't making a wrong decision, it's missing the message that explains the decision in the first place. Medicare notices are often written in formal language, packed with fine print, and delivered in ways that don't feel urgent. A plain-looking envelope, an online message you didn't know existed, or a letter mixed in with ads can all carry time-sensitive instructions that quietly affect your coverage. Many seniors don't realize that Medicare now communicates in multiple formats. Some notices arrive by mail, others appear in online portals, and some are handled through third-party plans. If you're not checking all channels regularly, it's easy for an important notice to slip by unnoticed. And unlike bills or appointment reminders, these messages don't always come with bold warnings. They look routine until the deadline passes. What makes this especially stressful is that fixing a missed notice is far harder than responding on time. Once Medicare systems move forward, reversing a change can take weeks of phone calls, resubmitted documents, and waiting. During that time, seniors may face denied services, uncovered prescriptions, or higher out-of-pocket costs. April is especially risky because many notices sent earlier in the year reach their final action point around this time. The key takeaway is simple but powerful. Treat every Medicare notice as urgent, even if it doesn't look important at first glance. Open it, read it, ask questions if something isn't clear. Medicare rarely gives second chances on deadlines, and silence is often interpreted as agreement. Staying alert to notices isn't about being anxious, it's about staying in control of your health care before small oversights turn into big problems. Let's be real. How many Medicare letters are sitting unopened right now? Drop a comment and tell us what you usually do when one arrives. We put a lot of time and research into making this clear and useful, so please subscribe. Just one click helps us keep seniors informed and protected. Number 9. Late penalties can follow you for the rest of your life. One of the most misunderstood and most costly parts of Medicare is how late penalties work. Many seniors think missing a deadline just causes a temporary issue that can be fixed later. In reality, certain Medicare penalties are permanent. Once they're triggered, they don't disappear after a few months. They stay with you for life, quietly increasing your healthcare costs every single month. Here's how seniors fall into this trap. If Medicare believes there was a gap in coverage, especially for drug plans or certain enrollments, it can apply a penalty that's added to your premium. That extra charge may look small at first, but it compounds year after year. Over time, seniors can end up paying thousands of dollars more simply because of one missed action, missed notice, or delayed response. What makes this especially painful is that many penalties happen without bad intentions. Seniors didn't refuse coverage, they didn't cancel anything, they simply didn't respond in time or assumed they were already protected. April is dangerous because it's when missed confirmations and unresolved issues can officially turn into recorded lapses. Once Medicare systems log that lapse, reversing it is extremely difficult, sometimes impossible. The emotional toll matters too. Seniors on fixed incomes feel the squeeze every month, wondering why their costs keep rising. The truth is, these penalties are avoidable, but only if you act before deadlines pass. Understanding that Medicare deadlines aren't flexible is critical. A small delay today can quietly lock you into higher costs for the rest of your life, and that's why staying alert before April is not optional, it's essential. This one hits hard. Did you know Medicare penalties can last a lifetime? Tell us in the comments if this was new information for you. We put serious research and care into exposing things most people never explain, so please subscribe. Just one click helps us keep protecting seniors like you. Number 10. One simple action can protect everything you've earned. After hearing all these risks, it's easy to feel overwhelmed, but here's the powerful truth. Protecting your Medicare usually comes down to one simple action: taking time to actively review and confirm your status before April. That's it. No complicated procedures, no legal battles, just awareness and timely action. Seniors who stay protected aren't lucky, they're informed. This one action includes opening every Medicare-related notice, confirming your personal details, plan enrollment, and assistance status, and responding before deadlines pass. It also means double-checking that your address, income information, and plan choices still reflect your current life. Many seniors lose benefits not because they don't qualify, but because systems assume silence means nothing is changed. Medicare doesn't chase confirmations, it expects them. What makes this action so powerful is that it prevents every problem we've discussed. It stops silent reviews, protects prescription coverage, prevents penalties, and keeps assistance programs active. Seniors who do this once a year avoid months of stress, phone calls, and out-of-pocket costs. April is not just another month, it's a checkpoint when missed actions turn into permanent consequences. The biggest mistake seniors make is waiting until something breaks. By then, fixing it takes time, energy, and patience, things no one should have to spend just to regain what they already earned. Taking control before April puts you ahead of the system, not trapped inside it. Medicare works best when you stay engaged, informed, and proactive. One small step today can protect your health care, finances, and peace of mind for the entire year ahead. And that's a step every senior deserves to take. Before you go, what's the one Medicare task you've been putting off? Write it in the comments, and let's make sure no one faces this alone. We put real effort, research, and care into every video, so please subscribe. Just one click helps us keep protecting seniors like you.
As we've seen throughout this video, Medicare isn't just something you sign up for once and forget about. It's a system that depends on attention, timing, and awareness, especially for seniors living in California. The most dangerous problems don't come from doing something wrong, but from doing nothing at all. Missed notices, skipped confirmations, or delayed paperwork can quietly turn into paused benefits, higher costs, or lifelong penalties. And by the time many seniors realize what happened, the damage is already done. The good news is that none of this requires expert knowledge or complicated steps. Protecting your Medicare comes down to staying engaged, opening every notice and taking action before deadlines, especially before April, when many reviews and confirmations reach their final stage. This one habit can protect your healthcare access, prescription coverage, financial assistance, and peace of mind for the entire year. Seniors who stay informed don't just avoid problems, they stay in control. If there's one takeaway from this video, let it be this: Medicare rewards awareness and punishes silence. The system won't chase you down or explain what went wrong in plain language. It expects you to respond, confirm, and stay current. That may not feel fair, but understanding how it works gives you power. You've earned your Medicare benefits through a lifetime of work, and no one should lose them because of a missed letter or misunderstood deadline. Take a moment after this video to review your information, check your notices, and make sure nothing is pending. That small step today can save you months of stress tomorrow. Staying informed isn't fear, it's protection. And when it comes to your health and security, being proactive is the smartest decision you can make.